Attention, all medical staff. Trauma code for children.
For the first time, we gain unprecedented access into Singapore's largest children's intensive care unit.
Working in the ICU, even if your feet are paddling furiously underwater, you have to still be able to perform efficiently.
Stats are improving.
Over 22 doctors and nurses work together every day to save children on the brink of death.
Why not me? Why my son?
There is no room for mistakes.
Intubating the patient.
We are like the gatekeepers. They were the last line in this hospital.
There are no easy decisions.
We may have to let her go.
We reveal the daily fight for survival of these little warriors.
Give me a high five. Xinlin, high five. Where's your hand?
And the staff who care for them.
You're doing very well. So brave.
This week, 2 3-year-olds are fighting for their lives.
Okay, 1, 2, 3.
How do they and their parents stay strong?
There's no time for sadness. We just enjoy and go through whatever we have now. No loose grip, yes.
17-year-old Kristy is about to have open-heart surgery.
Can I take a look with your barista? Can I see?
I'll check. Where is it?
In the meantime, this side over here.
A narrowing in the aorta, the largest artery in the body, is causing obstruction to blood flow to her lower body. But this is not Kristy's first time going under the knife.
Any cough and colds previously?
No.
How about 2 weeks ago? Don't have.
Don't have, but a few days ago you reported that she has some sign of inflammation on the ear. Yes.
Kristy suffers from diabetes and has hearing and eyesight problems, which may be linked to her underlying condition, suspected to be a mitochondrial disorder.
When she was born until now, right, she has underwent many operations. She is a very strong and special sister of mine.
Recently, doctors have discovered this problem with Kristy's heart. Left untreated, the narrowed artery could lead to complications like high blood pressure and kidney failure. Or in the most severe situation, heart failure.
My dad and my brothers all are worried because normally it's like afternoon 2 or 3 p.m. should be done.
But it's well past 5 p.m. and Kristy is still in surgery.
Here is a big stress and different doctor coming out and in. We don't know our sister, the operation will be successful or not.
After open heart surgery, patients have the potential to be unstable. So Kristy must recuperate in the children's ICU. The children's ICU at KK Women's and Children's Hospital is Singapore's largest.
She underwent ultrasound-guided lumbar puncture because she had a low-lying corner, so the NES wanted it to be ultrasound-guided.
It's really an assault of senses.
So this is better.
Yeah, and on the left side.
You got lucency here.
Yeah, oh yeah.
You didn't have there, right?
You're hearing all the different inputs from the doctors and nurses and therapists. You look around you, you see machines, and you hear beeping sounds.
The ability to stay calm is about being able to anticipate everything that possibly can go wrong and having solutions to all those possibilities even before you walk into the arena.
Don't cry, don't cry.
This bacteria that she has is actually multi-resistant. This bacteria is like a ticking time bomb.
Shikin's daughter Aulia is also in the children's ICU, fighting a life-threatening blood infection. The 3-year-old leukemia patient relies on a central line, a tube that goes into a big vein for medicine. But this central line has become infected too. In the meantime, doctors rely on small veins in Aulia's hands.
She was getting distressed, and the doctors and nurses and the parents are also stressed by trying to poke her on the hands repeatedly, and we are finding it increasingly difficult to find a good vein on her.
In the past year, this little fighter has survived 4 rounds of chemotherapy.
She also sometimes will ask me, "Mommy, why am I here? Why am I not going to school? And why am I not home? And why am I every day here with the doctor and nurses?" She got traumatized with all the pokings, the surgery, the radiations when she needs to go for CT scan, MRI. Mommy here, okay? Mommy here. Mommy check for you? Can? Mommy check for you? Okay, Mommy check for you. Okay, Mommy check.
Aulia needs to be brave for these next few days.
Do the ultrasound first and then for the stomach to make sure there's no pus.
There are limited antibiotic options to fight this resistant bug. Now she's trying them out.
Okay, finish. No more. No more, finish.
While Aulia waits, she must be confined to her room 24/7.
So her lungs are clear. Abdomen is slightly full but very, very soft. Now sounds positive. No, I think she's okay. Okay. Bye-bye.
Aulia is getting restless, and this is her only source of comfort.
Recently, she actually watched Minions movie, and so I think she's into Minion now. Yeah, two items. Aulia wanted Minion pacifier, but I couldn't find anywhere in KKH, so I actually replaced with Minion sticker. I hope she like it, yeah. Aulia, I'm back. Aulia, I'm back. Look what I bought for you. Okay. Hey, look. What's this? What's this? What is this? Sticker. You like it? You like it? And I got for you this one. Okay, what do you say? Thank you, who? Thank you, Mommy. Okay, welcome. This to her. Thank you so much. Thank you. I'll just pass it to her later. Dr. Natalie actually bought for her one toys. Yeah.
Is she still complaining of a lot of pain?
No, actually. Not really. Good. Most of the doctors here knows Aulia. She's kind of bossy, so whenever she wants something, she must get it. Nah, doctor give you. Must say thank you to her, okay? I think the doctors are also, trying to win her heart out somehow before they're doing some procedures on her. So yeah, I think I think as long as she's happy, I think everyone's happy about it also. She's missing Mommy.
Christie's surgery took 7 hours instead of 4. She's recuperating in the children's ICU.
Okay. Her hand pain. Her pain,
But there are complications.
She's still very pain. 1 to 10, she said 10. The most pain.
Where are you?
没事，我看一下。没有事的，你带就对了。
After an intense 7-hour open-heart operation, Christie's lower body will now get ample blood from her heart.
听到我讲话没有？听到。头发这样长没有剪哦，那边掉那边掉，乱七八糟。还是我剪头发吧。
不要。
But she needs to stay in the children's ICU in case her condition turns.
现在护士问你什么，你就回答他，听到没有？
知道。
哪里痛？这边痛，那边痛。
香我很痛哎。
啊，那你就好好休息咯。听到没有？
听到。
After she come out, she can message us and tell us that I'm very strong. You don't need to worry about us.
Christy 头晕吗？有没有头晕？啊，头晕啊
What?
Are you dizzy?
No.
No 啊。Then you say God. 你讲有头晕，对吗？对吗？
没有。
But 对吗？我讲对吗？
可以。
Correct 啊。
Christy is working hard to get better and is on track to go home soon.
Initially, when you just have had cardiac surgery, you would have a lot of pain. So she has to actually overcome, her pain.
3，你自己算。是。再做。哦。哇。
She was also quite determined. Like when you mentioned, okay, if you walk a little bit more, you're going to be going home. You can aim for going home faster. Yeah, so I think that motivated her.
Very good. Okay. High five.
Just when it appears Christy is out of the woods, today, doctors bring bad news.
Yesterday drainage how much?
Yesterday she drained 30.
30
mils of hemoserious.
Last drainage is at 10 a.m.
There are complications to Christy's surgery.
Cut down to dextrose 10% and then see whether or not the endocrine is agreeable, okay? Alright.
Lymphatic fluids are leaking in Christy's chest cavity.
Arrange for her to get engaged in the hospital.
Christy will have to stay for another 2 weeks.
Christy is someone who likes to eat. So when she came to know that she cannot eat for close to 2 weeks, she was quite upset.
Not only must Christy stay in the hospital, she will also need to get her food intravenously. Christy is not taking the news well. The normally chatty teenager is keeping to herself.
Hello, Christy. Christy, can you speak English? Can, right? 还是你要讲华语？不要吧。讲华语可以，讲英文还可以，对吗？
Christy's doctors have called in child life therapists to NewsAsia to help investigate.
So we're going to try to make either a bracelet or a necklace. What would you like? A bracelet? You like that? Okay. What is your favorite color?
I like black and white.
You like black and white. Okay, so we have some white here.
Child life therapists help to support young patients who face challenges in hospital.
这个地方是你的家吗？不是 ，then 是什么？医院对吗？
我要
KK Hospital 对吗？啊，为什么你来这边 ？What are you doing in KK Hospital？ 做 operation， 现在好了吗？有舒服吗？不好，为什么呢？
这一个星期哎。
It's okay， 一个星期，为什么一个星期 ？Why so long？
还要过2个星期。
I think that kind of tickled her to hear an Indian person speaking in Mandarin, and I think she took pity on me. She said, "Okay, let's be nice with Tanuja." So that's what she did. 有没有力？有很多力吗？Okay, I feel strong. She couldn't see an end in sight because she really wanted to go home, but every time when she asked the doctors to say a couple more days or a little while longer, so I think that was really hard for her also to accept.
Xie Dingshan knows what it's like to live with uncertainty. His 3-year-old daughter, Xinlin, has been rushed to the children's ICU multiple times over the last 2 years. Her body reacts severely to the common cold and the rhinovirus which causes it.
I was so irritated by that rhinovirus, so it has been like bothering her for the past 2 years. So I start googling around and ask myself, what does rhino scare of? And I was telling my wife that I cannot take it. I want to find something that can fight the rhino. So I went down and get two rhino toys and put it here. And hopefully that she give us some emotional support that we can fight this rhinovirus. And as like previous few years, we get to go home.
Xinlin suffers from spinal muscular atrophy, a progressive and incurable genetic condition.
Okay, 1, 2, 3.
She can barely breathe on her own. Simple infections like the common cold leave her breathless and needing the mechanical ventilator in the children's ICU to pump air into her lungs. Breathing this way is very painful, but Xinlin is still fighting.
Throughout the whole hospitalization, who has been seeing her heart rate going at 150, 160, is kind of like signal to tell us that she's not giving up.
The ventilator is now Xinlin's lifeline, but for each extra day she stays hooked up, the more her muscles weaken. Too long, and she may never breathe on her own again. The doctors have told Dingshan and his wife when they can remove Xinlin's ventilator. Dingshan and his wife have to decide what to do if she fails to start breathing on her own again.
Okay, yes.
For 3-year-old Muhammad Haris, sitting up in bed is a miracle all its own. 2 weeks ago, he was attacked by 3 viral infections at the same time.
Okay, slowly, slowly.
An attack which nearly shut down his liver and kidneys.
The first day in school, when my wife sent him there, he's in a good condition. When he going back home, he feel like so weak, so tired. Then suddenly he vomit. It's around 1 a.m. He start to feel breathless.
Haris might have been brought back from the brink, but the team's work is not done. His family is not coping well with the shock of his sudden illness.
I don't care about myself, I only care about my son. His life, he's new to this world. He haven't know what is going on. Like, not like us, we really feel and we really enjoy all our life.
Because when you see the child suffer, and you feel you can't, because as parent, you want to hug, you want to pamper the child. You don't want to see them
suffer
in pain.
Medical social worker Majella Irudayam has been meeting Haris's family every 3 days since he was admitted.
Sanggup melihat anaknya kesengsaraan. Kita nak anak yang baik.
To her, it's because that Haris will never bear to apart with her.
That means they're always together.
Always together.
Within the children's ICU, most families are immediately assigned a social worker to help them cope with the stress of having the child admitted.
Kalaulah penyakit anak aku ni boleh kau pindah ke aku boleh. Jangan kasih anak aku sakit. Aku tak boleh tengok anak aku sakit. Lebih baik aku ini sakit jangan anak aku, itu doaku. Aku tak sanggup tengok anakku macam ini.
Tell her these are normal reactions. It's like a trauma because
ini perkara biasa dah memang setiap orang tua akan melalui kalau anak dia sakit macam ni.
on the surface they tend to be happier, they're relieved, and you think that they're happy and they're coping. But many of them have not processed that feelings or that fear of the child's admission. Most of them break down and they're still anxious. because the fear or the thought of they may have lost their child or the child being so sick still torments them.
Maybe press it extra more.
Oh, you turn the morphine, but you
She
still
off
press
the
it.
morphine.
Yeah.
You just leave on
Keep
press it.
Now it's 0.5. Okay.
Senior resident Dr. Sudipta has completed 1 month of her residency at the Children's ICU.
Paracetamol is that?
Yeah, we already.
So we'll order like ABC.
And one key thing that she's learned is how to better channel her emotions.
Death is quite commonplace sometimes in our profession. Some people think we get used to it. I don't think we get used to it. I think we just have to know how to handle it. You wonder if you could have done something more, of course, because you always hope that maybe there was something you could have done, but I think you have to have closure. You want to make sure that you are still prepared to make sure the next patient walks away fine from ICU.
One patient who is just days from being discharged is 17-year-old Christy Tan.
哇，很多天没有吃了，几天没有吃
2個星期幾呢？
，15天了，好吃吗？
好。
很久了哈，慢慢吃哈，慢慢吃哈。
Let's put a tick. Tick. Okay, your turn. Where are you going to put? Where, here? Okay, let's go. Push. It's okay, don't worry.
Over the last 3 weeks, child life therapist Tanuja Nair has seen a marked change in Christy's attitude towards her recovery.
It was interesting to see her slowly coming out of her shell and actually sharing about experiences, or actually telling the nurses, no, I think you should do it this way, you should stand on this side and help me with that. So she was taking charge a little bit more of her cat.
这个是说你不用上体育课 until 31号，因为你的手术。
Christy will need that resilience. Individuals with mitochondrial disorder are at risk of organ failure in the future.
好像那种炸的东西全部都不可以吃，炸的不可以。然后果酱哦，花生酱不可以吃。
But while Christy gets to go home,
Take care.
3-year-old Xinlin may not.
In case the next extubation is still not successful, then we may have to make the worst decision to actually to let her go. Yeah.